Cataracts are one of the most common eye conditions, especially as people age. It occurs when the lens of your eye, which is normally clear, becomes cloudy. Think of the lens in your eye like the lens of a camera. It helps focus light onto the retina at the back of your eye, which then sends signals to your brain so you can see clearly. When the lens gets cloudy, it's like looking through a foggy or dirty window. Everything becomes blurry, hazy, or less colorful. So, why does this happen? Well, this cloudiness occurs when proteins in your eye's natural lens break down and clump together. This clumping creates cloudy or opaque areas in the lens. Cataracts usually develop slowly over time, and they can affect one or both eyes. It is an incredibly common eye condition, affecting over 24 million Americans aged 40 and older, and they remain the leading cause of blindness worldwide. By age 75, nearly half of all adults develop some degree of cataracts, highlighting their prevalence, especially among the aging population. While they're most common in older adults, cataracts can occur at any age due to various reasons, which we'll get into later. However, it's important to note here that cataracts are not contagious, and they don't spread from one eye to the other, although they can develop in both eyes at the same time. Types of cataracts. There are several types of cataracts, and they're categorized based on where and how they develop in the lens. Here are the main types. Number 1. Nuclear cataracts. These form in the center of the lens and are often associated with aging. They can cause the lens to turn yellow or brown, which can affect how you see colors. At first, they might temporarily improve your near vision, known as second sight, but this improvement doesn't last. Number 2. Cortical cataracts. These start at the edges of the lens and work their way toward the center. They look like white, wedge-shaped opacities and can cause issues with glare and light sensitivity. Number 3. Posterior subcapsular cataracts. These cataracts develop at the back of the lens, right in the path of light as it travels to the retina. They tend to progress faster than other types and can make it hard to read or see in bright light. This type is more common in younger people and people with diabetes. Number 4. Congenital cataracts. Some people are born with cataracts or develop them during childhood. These can be caused by genetic factors, infections during pregnancy, or other conditions. Causes of cataracts. Cataracts develop when proteins in the lens of your eye clump together, causing cloudiness. But what leads to this happening? Well, aging is the most common cause. As we get older, the lenses in our eyes become less flexible, less transparent, and thicker over time. Genetics also play a role. If your parents or grandparents had cataracts, you might be more likely to develop them too. Other common causes include eye injuries, which can lead to traumatic cataracts, and prolonged exposure to ultraviolet light, which can damage the proteins in the lens. Medical conditions like diabetes are also significant risk factors for cataracts, as high blood sugar levels can accelerate protein damage in the lens. Certain medications, such as corticosteroids, are also linked to cataract development when used over long periods. Finally, lifestyle factors, such as smoking, heavy alcohol consumption, and poor nutrition, can increase the risk of cataracts. Symptoms of cataracts. Cataracts don't develop overnight, so the symptoms often come on gradually. At first, you might not even notice anything is wrong. But as the cataract grows, you'll start to experience changes in your vision. Here's what it might feel like. Blurry vision is the most common symptom. It's like looking through a foggy window, and no matter how much you rub your eyes, the blurriness doesn't go away. Difficulty seeing at night is another common issue. Cataracts can make it harder to see in low light, which can be especially problematic when driving at night. Sensitivity to light is also a frequent symptom. Bright lights might feel overwhelming or cause glare. You might find yourself squinting more often. Fading colors are another sign of cataracts. Colors might appear less vibrant or have a yellowish tint. This happens because the cloudy lens filters out certain wavelengths of light. Double vision can also occur in some cases. The cataracts in your eyes can cause you to see double images, even when you're only looking with one eye. Frequent changes in your eyeglass prescription might also be a sign. If you find yourself needing new glasses more often than usual, it could be due to cataracts. Some people with cataracts also experience halos around lights. You might notice rings or halos around lights, especially at night. Finally, difficulty reading is a common issue. Small print might become harder to read, even with reading glasses. So, if you're experiencing any of these symptoms, it's a good idea to see an eye doctor. They can help determine whether cataracts or another eye condition is causing your vision problems. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of cataracts. Diagnosing cataracts is a straightforward process that your eye doctor can do during a comprehensive eye exam. Here's what to expect. First, your doctor will likely perform a visual acuity test. This is the classic eye chart test where you read letters from a chart to measure how well you can see at various distances. Next, they might use a slit lamp examination. This involves using a special microscope called a slit lamp to examine the structures at the front of your eye, including the lens. This helps them see any cloudiness or abnormalities. A retinal exam is another common test. After dilating your pupils with eye drops, your doctor will use a bright light to examine the back of your eye, including the retina. This helps rule out other causes of vision problems. Tonometry might also be performed. This test measures the pressure inside your eye and is primarily used to check for glaucoma, but it's often part of a comprehensive eye exam. Treatment for cataracts. In the early stages, if your cataracts are mild, you might not need surgery right away. Your doctor might recommend stronger lighting for reading, anti-glare sunglasses for driving, and possibly a new glasses prescription. These measures can help you manage early cataracts, but they won't stop the progression of the condition. It's worth trying these approaches first if your cataracts aren't significantly impacting your daily life. However, if cataracts start to interfere with your daily life, surgery is the way to go. Let's dive into the treatment options available. Number 1. Cataract surgery. Cataract surgery is the most effective and definitive treatment for cataracts. It is a highly successful procedure performed on millions of people each year. The surgery involves removing the clouded lens and replacing it with a clear artificial lens, known as an intraocular lens. The procedure is typically done on an outpatient basis and takes less than an hour. During the procedure, the surgeon will use local anesthesia to numb your eye, so you won't feel any pain. They'll make a tiny incision in your eye and use ultrasound waves to break up the cloudy lens, which is then removed. The intraocular lens is inserted in its place, and the incision is so small that it often doesn't require stitches. Most people notice an improvement in their vision within a few days. You'll need to use prescribed eye drops to prevent infection and reduce inflammation. While cataract surgery is generally safe, like any surgery, it carries some risks such as infection, bleeding, or retinal detachment. However, these complications are rare. Number 2. Laser-assisted cataract surgery. This is a more advanced version of traditional cataract surgery. Instead of using ultrasound to break up the lens, the surgeon uses a laser to make precise incisions and soften the cataract. This method can be more accurate and may reduce the risk of complications. While it's more expensive than traditional surgery and isn't necessary for all cases, it can be particularly beneficial for certain complex situations or when treating advanced cataracts. Number 3. Advanced intraocular lenses. For individuals undergoing cataract surgery, advanced intraocular lenses are an option that can enhance vision beyond what was possible before cataracts. When you have cataract surgery, you'll need to choose an intraocular lens. There are several types, each with its own benefits. Monofocal intraocular lenses provide clear vision at one distance, usually far away. You might still need glasses for reading or close-up work. Multifocal intraocular lenses allow you to see clearly at multiple distances, reducing your need for glasses. Toric intraocular lenses are designed to correct astigmatism, a condition that causes blurry vision due to an irregularly shaped cornea. Accommodating intraocular lenses move or change shape inside your eye, allowing you to focus on objects at different distances. At the end, cataracts might sound scary, but they're a common and treatable condition. If you're experiencing symptoms like blurry vision, difficulty seeing at night, or sensitivity to light, don't ignore them. Schedule an appointment with your eye doctor to get a proper diagnosis. With modern treatments, especially cataract surgery, you can regain clear vision and get back to enjoying life without the hassle of cloudy eyesight. Now, we want to hear from you. Have you or someone you know ever dealt with cataracts? How did it affect daily life, and what treatments worked best? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.